Joining me now is Kelley Prince. She's the president of Behavioral Consulting of Tampa Bay. Thank you so much for joining us today.
Thank you for having me.
So we're going to talk about a spectrum disease. So it's interesting when we talk about spectrum, we talk about this big variety of things that look kind of the same but have different variations. So we're going to talk about autism.
Okay.
And if you could just give us a little glimpse of what the spectrum of autism is, different names they call it over the years, and what we look at today.
Okay, well, autism is an umbrella, and it carries a few different diagnoses underneath that umbrella. So you have children that have a diagnosis of PDD-NOS, which is pervasive developmental disorder, not otherwise specified. Some people consider them having a lesser severity of autism. So some of those individuals have some communication deficits, some social deficits, and some minor repetitive behavior. But then you have a child diagnosed with autism, and sometimes those individuals can be less severe or more severe. The more severe individuals, we see kids 5, 6, 7 years old that have no form of communication at all. So they have no ability to get their needs or wants met. They don't understand any language, so if you ask them to come here or to sit down, they don't have any receptive language as well. Very little ability to imitate others. Socially, they don't make a lot of eye contact, and they are engaging in a lot of repetitive behavior throughout the day. You also have individuals diagnosed with Asperger's disorder. And this disorder is a little bit different in the fact that typically there's not a language delay initially, but these children are still suffering from the social deficits as well as some of those repetitive behaviors. So it certainly is a spectrum, and you can see individuals just with varying levels of severity in each of those characteristics.
So this has been popularized over several things. I think Rain Man had an idea of autism,
Right.
and they were called, I think, were they idiot savants in the past, or is that a different thought pattern altogether?
Yeah, I mean, I typically don't use that word, but
yeah.
you know, a lot of the individuals with autism do have splinter skills, we call them, meaning,
Okay.
you know, there's areas of skills that they're really deficient at, but that there's always also areas that they're actually really good at, and that they're able to exceed some of their peers in some of those areas.
All right, so we have from very spectrum of disease issues, and we have, as they get worse, they have more and more trouble with communicating as their primary piece, but also kind of fitted into society, right?
Absolutely, because typically when you have the inability to communicate, then you engage in problem behavior. So a lot of the people that we work with do have a lot of high rates of problem behavior, tantruming, head banging, biting, hitting, and things of that sort.
So those severe symptoms, obviously, someone wants to do something about. So there's a study that
Yes.
came out that was kind of odd, I would say.
Okay.
So they had, they call it broccoli sprouts for autism. Tell me a little bit about the broccoli sprouts, what they think is in it that's going to be helpful for it, and what the study actually told us.
Well, it looks like there's an extract, a broccoli extract, that they have in a pill form that they're giving to these individuals. And in the study, they were moderate to severe older adults with autism, and they were all males. And what the study showed is that out of the 26 males that they gave the extract to, about 2/3 of them showed some improvement over time in behavioral and social skills. I think it was about a 4-week period of time that occurred, and once they stopped or discontinued the extract, then they kind of returned to the same behaviors that they were engaging in previously.
So extracts obviously mean they take a bunch of the stuff and squish it down. I just can't go to the store and buy this and get enough of it in me, right?
Not to my knowledge, no.
Okay. And when we looked at this spectrum piece and the outcomes for it, it said that a lot of the stuff they showed was improvement of the mood, and did it help any with their ability to learn or do anything else?
It seemed like their communication improved. It seemed like the repetitive behaviors. So if you're engaging in a lot of repetitive behaviors, then you have a hard time focusing and attending and communicating. So it looked like it covered several different skill areas and improvement in behaviors in those areas.
So maybe a major step.
It could be.
Yeah.
Certainly it's something that we want to consider and do further research in, absolutely.
Sure. So autism seems to be something we hear a lot about in the news. How popular, or should I say popular, how common is it nowadays?
Unfortunately, it's more common than ever. At this point, 1 in 58 boys or males has a diagnosis of autism. So it's unfortunately becoming more prevalent. A lot of people are saying, well, is it more prevalent now because there's just, you know, we're more aware of it, there's more diagnosing of it. Is there something environmental that's causing it? So unfortunately, we really don't know, but it looks like there's probably a combination of the two, that there's some environmental component, there is a genetic factor, but I'm sure we're certainly diagnosing it more often, but you know, whether there's more children diagnosed or that has this disorder now compared to 10, 20 years ago, it's hard to say.
Sure. So when we look at your job, behavioral consulting, say this doesn't work. What do you normally do with an autistic individual? How do we redirect these individuals, and tell us about your job?
Okay. Well, a lot of times, like I said, they are lacking social skills, communication skills, and have repetitive behaviors. So what we do is we work with children using applied behavior analysis therapy. And it's the only therapy that has over 40 years of research to show that it is effective for treating individuals with autism. So we do an initial skills assessment. We look at their language, we look at their social skills, their self-help skills, independent behavior, play skills, everything that's important for that individual to be engaging in at that time. Based on that assessment, then we do an intervention. And most of our kids are coming in for at least a minimum of 10 hours a week for intensive therapy. Anywhere from 10, 20, 30 hours a week of intensive therapy. But like I said, it's the most researched intervention, and these kids are making progress. They're learning new skills and obviously reducing problem behavior at the same time. So it's kind of a combination of teaching skills that they need to be using or learning at that time, and also reducing the problem behavior that comes along with that.
So really there's no medications for this as a behavior learning process. I know we have medications for psych underlying issues. We use those, unfortunately, in individuals that have problems with behavior, but your way seems to make it a little better, a little cleaner, less issues with side effects.
I mean, like I said, it's the most researched intervention for autism, but I will say that some of the clients that we do work with, some of them are on medication for various reasons, sometimes to help reduce anxiety, to improve attention. So, but certainly there's not a medication that helps, autism symptoms in general, but some of the specific symptoms, some of our clients are, getting that type of treatment.
Sure, so if this actually worked out, this would be really a great piece as a treatment piece, since there's limited abilities. The behavior portion's obviously working to a point, but there's obviously individuals who would benefit from it as well.
Certainly, if you can get the kid attending and you can reduce the problem behavior and get them focusing, then the ability for them to learn is increased, and so we would better be able to do our job, absolutely.
Excellent. Well, thank you so much. Thanks for telling us about autism and all the treatments out there, and hopefully this new extract's very helpful for the future, for research, as well as our kids.
Okay, thank you.
You're welcome.